Regular blood tests monitoring kidney function and potassium levels are necessary when taking spironolactone. Despite these considerations, many dermatologists consider spironolactone an excellent option for hormonal acne, particularly when combined with topical treatments and possibly birth control pills. Lifestyle factors significantly impact hormonal acne. Stress increases cortisol production, which increases androgen activity and sebum production. Implementing stress reduction techniques like meditation, yoga, regular exercise, and adequate sleep improves hormonal balance and acne. Regular aerobic exercise appears particularly beneficial for hormonal regulation. Diet influences hormonal acne through multiple mechanisms. High glycemic foods spike blood sugar and insulin, stimulating sebaceous gland activity and androgen production. Reducing refined carbohydrates and sugar while increasing complex carbohydrates, fiber, and whole foods helps regulate blood sugar and improve acne. Some research suggests dairy products, particularly skim milk, may trigger acne through hormonal pathways. Reducing dairy or switching to hormone-free milk might help if dairy appears to worsen your acne. Insulin resistance, common in women with PCOS, worsens hormonal acne. Reducing refined carbohydrates and sugar, eating regular meals with balanced macronutrients, and maintaining healthy body weight improves insulin sensitivity and can significantly reduce acne. Adding inositol supplementation may help with insulin resistance in some women. Discuss this with your healthcare provider. When to consider professional treatment for hormonal acne. If your acne is severe, widespread, or causes significant psychological distress, see a dermatologist and gynecologist together. If topical treatments haven't adequately controlled your acne after 3 months of consistent use, discuss systemic treatment options. If you suspect hormonal imbalances, irregular periods, excessive hair growth, fertility issues, see both specialists. Guide 8. Natural and evidence-based home remedies for mild to moderate acne. While prescription and over-the-counter acne treatments are scientifically validated and highly effective, several natural ingredients have research supporting their acne-fighting properties. These natural remedies can supplement professional treatments or be used alone for mild acne. Understanding which natural ingredients are evidence-based versus marketing hype is crucial. Tea tree oil is one of the most researched natural acne remedies. Multiple studies demonstrate its antibacterial and anti-inflammatory properties. Tea tree oil kills acne-causing bacteria and reduces inflammation associated with pimples. However, undiluted tea tree oil is irritating and can cause contact dermatitis, redness, and dryness. Always dilute tea tree oil with a carrier oil like coconut oil, jojoba oil, or argan oil before applying to skin. A typical dilution is 5 to 10% tea tree oil mixed with carrier oil. Apply this diluted mixture as a spot treatment to individual pimples using a cotton swab. Don't apply to your entire face, as this may be overly drying. Aloe vera has well-documented anti-inflammatory and antimicrobial properties. Pure aloe vera gel, applied directly from the leaf or as a pure gel product, soothes inflamed acne, reduces redness, and promotes healing. Aloe vera doesn't have the side effects associated with many acne treatments. It won't dry your skin excessively or cause irritation. Apply pure aloe vera gel as a spot treatment or all over your face as a lightweight moisturizer. Most people tolerate aloe vera well, though some experience mild irritation. If you're allergic to plants in the Liliaceae family, lilies, onions, garlic, you might react to aloe. Honey, particularly raw and manuka honey, has antimicrobial, anti-inflammatory, and healing properties. Raw honey contains enzymes and compounds that fight bacteria and reduce inflammation. It's gentle and suitable even for sensitive skin. Apply raw honey as an occasional face mask. Mix a small amount with water to create a spreadable consistency. Apply to clean skin for 10 to 15 minutes, then rinse with lukewarm water. You can do this 1 to 2 times weekly. Some people apply honey directly to pimples as a spot treatment. Honey is gentle, affordable, and many people find it effective for mild acne. Green tea contains powerful antioxidants called catechins that have antibacterial, anti-inflammatory, and sebum-reducing properties. Studies demonstrate that topical green tea application reduces acne severity. Brew strong green tea, allow it to cool completely, and use it as a rinse after cleansing, as a toner, or apply it to your face with a cotton pad. Alternatively, use a face mask or moisturizer containing green tea extract. Many commercial skincare products now include green tea for its antioxidant benefits. Most people tolerate green tea topically well, though those with sensitive skin might experience mild dryness. Zinc supplements taken orally may reduce acne severity, particularly in people who are zinc deficient. Zinc plays roles in immune function, wound healing, and anti-inflammatory processes. Studies show mixed results, but some demonstrate zinc supplementation improves acne, particularly in conjunction with other treatments. Typical zinc supplementation for acne is 25 to 50 mg daily. However, excessive zinc supplementation can cause nausea and copper deficiency, so don't exceed recommended doses without medical guidance. Consult your doctor before starting zinc supplements, particularly if you take other medications. Niacinamide, vitamin B3, is a natural compound with antibacterial, anti-inflammatory, and sebum-regulating properties. While available in supplements, topical niacinamide is more relevant for acne. Many skincare products now include 4 to 5% niacinamide. Studies demonstrate that niacinamide reduces sebum production and acne lesions with minimal irritation. It's suitable even for very sensitive skin and works well alongside other treatments. Azelaic acid, a naturally occurring compound found in grains like barley and rye, has proven antibacterial and anti-inflammatory properties. It's more commonly available as a prescription medication, Azelaic, Phenacea, or in over-the-counter products, but azelaic acid is naturally derived. It's particularly effective for post-inflammatory hyperpigmentation and rosacea-related acne. Dietary changes based on research can improve acne. Eating antioxidant-rich foods like berries, dark chocolate, and colorful vegetables reduces inflammation throughout your body, including your skin. Omega-3 fatty acids from fish, walnuts, and ground flax seeds have anti-inflammatory effects and may reduce acne. Increasing fiber intake through whole grains and vegetables improves digestion and may improve skin. Reducing sugar and refined carbohydrates reduces blood sugar spikes that worsen acne. Hydration deserves special mention. Drinking adequate water, about 8 to 10 glasses daily, maintains skin hydration from within, supports detoxification, and promotes overall skin health. While water alone won't cure acne, adequate hydration is fundamental to clear skin. Sleep is profoundly important. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves skin health and acne. Stress reduction through meditation, yoga, deep breathing, or regular exercise reduces cortisol and inflammation, directly improving acne. Chronic stress is a well-documented acne trigger. Even 10 to 15 minutes of daily meditation or yoga can measurably improve skin. Important limitations of natural remedies. Most natural remedies are suitable for mild acne only. If you have moderate to severe acne, particularly cystic acne, natural remedies are insufficient and you require professional treatment. Natural remedies work best alongside professional treatments, not as replacements. Natural doesn't automatically mean safe or effective. Many natural substances are irritating or ineffective for acne. Finally, natural remedies require consistent use for 4 to 8 weeks to demonstrate effectiveness. Don't expect immediate results. Guide 9. Spot Treatment Mastery. Targeted Acne Lesion Treatment and Prevention. Spot treatments allow you to apply potent.
Welcome to this peaceful space of learning and care. Take a deep breath in, feeling calm, enter your body. Exhale gently, releasing any tension. Today we're going to talk about preventing clogged pores, how to keep your pores clear and healthy through gentle, consistent practices rather than aggressive intervention. Clogged pores are at the root of many skin concerns: blackheads, whiteheads, acne, and rough texture. When pores become blocked with oil, dead skin cells, and debris, problems develop. But here's empowering news. Pore clogging is largely preventable through thoughtful daily habits and a gentle skincare routine. Let's begin by understanding what causes pores to clog. Your pores contain hair follicles and sebaceous glands that produce oil called sebum. This oil is natural and necessary. It protects and moisturizes your skin. Problems arise when too much oil is produced, when dead skin cells accumulate faster than they shed, or when external debris mixes with these and blocks the pore opening. Several factors contribute to clogged pores: excess oil production influenced by hormones, genetics, and stress; dead skin cell buildup from inadequate exfoliation or too rapid cell turnover; heavy or pore clogging skincare and makeup products; inadequate cleansing that leaves residue on your skin; environmental pollutants that settle on your skin; and touching your face frequently, which transfers oil and bacteria. Understanding these causes helps you prevent them systematically. The foundation of pore clogging prevention is proper cleansing. Cleanse your face thoroughly once daily in the evening to remove oil, dead skin cells, makeup, sunscreen, and environmental debris that have accumulated. Use a gentle but effective cleanser appropriate for your skin type. For oily or combination skin prone to clogged pores, a gel cleanser with salicylic acid can be beneficial. Salicylic acid is oil-soluble and penetrates into pores, helping keep them clear. Use 0.5 to 2% concentration. Double cleansing in the evening helps ensure complete removal of all pore-clogging substances. Start with an oil-based cleanser or micellar water to dissolve makeup, sunscreen, and excess sebum. Follow with your regular water-based cleanser to remove any remaining residue. Cleanse thoroughly but gently. Massage your cleanser onto your skin for a full minute, giving it time to work. Pay attention to areas prone to clogging: nose, chin, forehead. Rinse completely with lukewarm water. However, don't over-cleanse. Cleansing more than once daily or using harsh cleansers can strip your skin, triggering more oil production and actually worsening pore clogging. Balance is key. Regular exfoliation prevents dead skin cell buildup that contributes to clogged pores. Chemical exfoliation with AHAs or BHAs is generally more effective and gentler than physical scrubs. Salicylic acid, BHA, is particularly effective for preventing clogged pores because it penetrates into pores and dissolves oil and debris. Use a salicylic acid treatment 2 to 4 times per week, depending on your skin's tolerance. This could be a toner, serum, or leave-on treatment with 0.5 to 2% salicylic acid. AHAs like glycolic or lactic acid exfoliate the skin surface, preventing dead cell accumulation. These work well for many skin types. Use 5 to 8% concentration 2 to 3 times weekly. Don't use multiple exfoliants at once or exfoliate daily unless your skin clearly tolerates it without irritation. Overexfoliation damages your barrier and can worsen your skin. Choose your skincare and makeup products carefully to avoid introducing pore-clogging ingredients. Look for products labeled non-comedogenic, which means they're formulated not to clog pores. Common pore-clogging ingredients to be cautious of include coconut oil, though some people tolerate it fine, certain silicones in high concentrations, heavy oils and butters, some waxes, and thick, occlusive formulas if you're very oily. However, ingredient sensitivity is individual. A product that clogs one person's pores might be fine for another. Pay attention to your own skin's response rather than universally avoiding ingredients. For pore-prone skin, choose lightweight formulas, gel or gel cream moisturizers rather than heavy creams, fluid or gel sunscreens rather than thick creams, and mineral makeup or lightweight liquid formulas rather than heavy, oil-based makeup. Remove makeup thoroughly every evening. Sleeping in makeup is one of the surest ways to clog your pores. No matter how tired you are, at minimum, remove your makeup with micellar water before sleep. Moisturize consistently, even if you have oily skin. Dehydrated skin can actually trigger more oil production and more pore congestion. Use an appropriate lightweight, non-comedogenic moisturizer that provides hydration without heaviness. Sun protection is essential, but choose your sunscreen wisely for pore-prone skin. Mineral sunscreens with zinc oxide work well for many people prone to clogged pores. Lightweight chemical sunscreens are also available. Find one that doesn't feel heavy or greasy on your skin. Lifestyle habits significantly affect pore health. Don't touch your face unnecessarily throughout the day. Your hands carry oil, dirt, and bacteria that transfer to your skin and contribute to clogged pores. Every touch is an opportunity for contamination. Keep everything that touches your face clean. Change your pillowcase at least twice weekly. nightly if you're very prone to clogged pores. Use a clean towel to dry your face, or dedicate a small face towel that you wash frequently. Clean your phone screen regularly as it touches your face and harbors bacteria and oil. If you wear makeup, clean your brushes and sponges regularly, weekly at minimum. Dirty application tools harbor bacteria and reintroduce oil and old makeup to your skin, clogging pores. Avoid heavy, pore-clogging hair products near your hairline and face. Pomades, heavy styling creams, and thick conditioners can migrate onto your face, especially along your hairline and forehead, causing clogged pores and breakouts. Use lighter products or keep hair products away from your face area. Manage oil production through lifestyle factors. Stress increases cortisol, which triggers more sebum production. Whatever helps you manage stress, exercise, meditation, adequate sleep, relaxation practices, indirectly helps prevent clogged pores. Stay hydrated by drinking water consistently. When your body is well hydrated, your skin is better able to regulate its own oil and moisture balance. Eat a balanced diet. Some people find that dairy or high glycemic foods increase their oil production and pore clogging. If you suspect a dietary connection, try eliminating these foods for a month and observe whether your skin improves. Consider professional treatments if you're prone to persistent clogged pores, despite good home care. Regular facials with professional extraction by a trained esthetician can help keep pores clear. Professional chemical peels provide deeper exfoliation. Discuss these options with a licensed professional. Retinoids, either over-the-counter or prescription, are highly effective at preventing clogged pores by increasing cell turnover and preventing debris accumulation. If home remedies aren't sufficient, consult a dermatologist about whether retinoids might help. Maintain consistency with your prevention routine. Pores don't clog overnight, and keeping them clear requires daily attention to cleansing and regular exfoliation. The habits you build and maintain matter more than any single product or treatment. Be patient with results. Even with perfect prevention, occasional clogged pores may occur due to hormones, stress, or other factors beyond your control. Don't judge yourself or your routine based on occasional breakouts. Assess your skin over weeks and months, not days. Remember that some degree of visible pores is normal and natural. Pores are real structures in your skin that serve important functions. You're not aiming for invisible pores. That's not realistic or necessary. You're aiming for clear, unclogged pores that function properly. As we close, embrace this truth. Preventing clogged pores is about consistent, gentle, daily habits more than aggressive treatments. Proper cleansing, regular exfoliation, thoughtful product choices, and clean habits keep pores clear. May your pores stay clear and healthy. May you develop habits that prevent rather than treat clogging. May your skin be balanced and comfortable. Thank you for this time together. Prevent gently, consistently, and patiently.
Multiple studies demonstrate correlation between milk consumption and acne severity. The effect appears strongest with skim milk, likely because fat-soluble hormones are removed during processing, leaving bioactive peptides. If you consume significant dairy and struggle with acne, try reducing or eliminating dairy for 4 to 6 weeks to assess impact. Many people notice significant acne improvement after reducing dairy. If dairy doesn't appear to worsen your acne, you don't need to eliminate it. Omega-3 fatty acids reduce systemic and skin inflammation. Foods rich in omega-3s include fatty fish, salmon, mackerel, sardines, walnuts, ground flax seeds, and chia seeds. Eat omega-3 rich foods 2 to 3 times weekly or consider supplementation if dietary intake is insufficient. Studies show that increasing omega-3 intake improves acne, likely through inflammation reduction. Antioxidant-rich foods protect skin from free radical damage and reduce inflammation. Berries, blueberries, strawberries, raspberries, dark leafy greens, spinach, kale, colorful vegetables, carrots, bell peppers, tomatoes, and dark chocolate all contain powerful antioxidants. Eating colorful foods daily provides antioxidant support. Zinc supports immune function and skin healing. Foods rich in zinc include oysters, beef, pumpkin seeds, and chickpeas. Some evidence suggests zinc supplementation improves acne, particularly in zinc-deficient individuals. Typical supplementation is 25 to 30 milligrams daily. Don't exceed this without medical guidance, as excess zinc causes nausea and copper deficiency. Vitamin D plays roles in immune function and skin health. Sunlight exposure stimulates vitamin D production, but many people don't get adequate sun exposure. Vitamin D-rich foods include fatty fish, egg yolks, and fortified milk. Some people benefit from vitamin D supplementation, particularly during winter or in northern climates. Typical supplementation is 1,000 to 2,000 IU daily. Consult your doctor about appropriate dosing. Hydration deserves emphasis. Drinking adequate water, about 8 to 10 glasses daily, more with exercise, maintains skin hydration from within, supports detoxification, and promotes overall health. Proper hydration improves skin clarity and reduces compensatory sebum overproduction from dehydration. Limiting sugar and refined carbohydrates is perhaps the single most impactful dietary change for acne. Sugar causes inflammation throughout your body, worsens acne, and accelerates aging. Reducing sugar by replacing sugary beverages with water, limiting desserts, and avoiding processed foods with hidden sugar improves acne significantly. Most people notice improvement within 2 to 4 weeks of reducing sugar. Stress is a major acne trigger. Chronic stress increases cortisol production, which increases inflammation and androgen activity. Stress also triggers immune dysfunction, promoting bacterial overgrowth. Implementing stress reduction techniques is therefore essential. Meditation, yoga, deep breathing exercises, regular exercise, and time in nature all reduce stress and cortisol levels. Exercise provides multiple acne benefits. Regular aerobic exercise, 30 minutes, 5 days weekly, reduces stress, improves circulation, regulates hormones, and promotes overall health. However, exercise-related acne can occur from sweat and friction. Shower immediately after exercising, change into clean clothes, and avoid touching your face during exercise. Despite temporary exercise-induced acne risk, the overall benefits of regular exercise substantially outweigh risks. Sleep profoundly affects skin health. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, disrupts hormonal balance, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves acne. Implement good sleep hygiene, maintain consistent sleep schedules, avoid screens an hour before bed, keep your bedroom cool and dark, and limit caffeine in the afternoon. Alcohol consumption worsens acne through multiple mechanisms. Alcohol increases inflammation, disrupts gut health, which influences skin and dehydrates skin. If you drink alcohol, do so moderately and ensure adequate hydration. Heavy alcohol consumption noticeably worsens acne in most people. Smoking impairs skin healing, increases inflammation, and worsens acne. Smokers typically have worse acne than non-smokers. Quitting smoking improves acne and overall health dramatically. Gut health increasingly appears important for skin health. Poor gut microbiota diversity, gut inflammation, and increased intestinal permeability, leaky gut, correlate with acne. Eating fermented foods, yogurt, kimchi, sauerkraut, fiber-rich foods, vegetables, whole grains, legumes, and possibly taking probiotic supplements supports healthy gut microbiota. While gut acne connections are still being researched, the evidence suggests supporting gut health helps skin. Hormonal regulation through lifestyle is important, particularly for women with hormonal acne. Regular exercise, stress reduction, adequate sleep, and healthy diet all support hormonal balance. For women with PCOS or obvious hormonal acne, these lifestyle factors may reduce symptoms enough to minimize or eliminate the need for systemic medications like spironolactone or oral contraceptives. Important perspective: diet and lifestyle changes typically take 4 to 8 weeks to demonstrate skin effects. Don't expect immediate results. However, after 8 to 12 weeks of consistent dietary and lifestyle improvements, most people notice significant acne improvement. These changes provide benefits beyond acne: improved energy, better sleep, improved digestion, and overall better health. Guide 15: Professional dermatological treatments, chemical peels, laser therapy, and advanced technologies. Professional dermatological treatments provide powerful acne management beyond what home skincare achieves. Understanding various professional treatments, their mechanisms, appropriate candidates, and realistic expectations helps you make informed decisions about whether professional treatment is right for you. Chemical peels use acids to remove skin layers, treating acne, scarring, and texture issues. Superficial peels penetrate only the outermost skin layer and are the mildest type. These use low-concentration acids, 15 to 30% salicylic acid or glycolic acid, and require minimal recovery. Most people experience slight redness that resolves within hours. Superficial peels are appropriate for mild acne, texture concerns, and maintenance. Monthly superficial peels combined with home treatments provide excellent acne management. Medium-depth peels penetrate into the dermis, providing more dramatic results but requiring more recovery. These use higher acid concentrations, 35 to 50% glycolic acid, TCA at 25 to 35%, or combinations, and require 3 to 5 days of significant peeling and flaking. Medium peels are appropriate for moderate acne, significant scarring, and hypertension. Acne resistant to standard topical treatments, particularly if inflammatory and deep, often reflects hormonal causes. Women with other hormonal symptoms, irregular periods, excessive hair growth, hair loss, fertility issues, should definitely pursue hormonal evaluation. Primary hormone involved in acne is androgen, particularly testosterone and DHT, dihydrotestosterone. However, most women with hormonal acne have normal total testosterone levels but exhibit heightened skin sensitivity to androgens. This explains why some women with normal hormones still have significant hormonal acne. It's about skin sensitivity, not absolute hormone levels. Relevant hormonal tests for acne evaluation include total testosterone, free testosterone, calculated or direct measurement, DHT, dihydrotestosterone, DHEAS, dehydroepiandrosterone sulfate, LH, luteinizing hormone, FSH, follicle-stimulating hormone, and androstenedione. These tests assess androgen status and ovulatory function. Additionally, tests for other hormones affecting acne include estradiol, progesterone, tested in luteal phase for ovulation confirmation, cortisol, for stress-related endocrine effects, and thyroid function, TSH, free T4, may be relevant. Ovulatory dysfunction, present in conditions like PCOS, contributes to hormonal acne. PCOS involves elevated androgen production, irregular ovulation, and insulin resistance. Women with PCOS typically have irregular periods, acne, hirsutism, excessive hair growth, androgenetic alopecia, pattern hair loss, and often obesity. Testing for PCOS is appropriate for women with these symptoms. PCOS diagnosis requires ovulatory dysfunction, irregular periods, plus hyperandrogenism, elevated androgens or clinical signs, and/or polycystic ovarian appearance on ultrasound. Baseline hormonal testing during the follicular phase, first 7 days of menstrual cycle, is standard because hormone levels are more stable and baseline during this phase. FSH and LH are assessed during the follicular phase. Progesterone is tested during the luteal phase, typically 7 to 8 days after ovulation, to confirm ovulation occurred. Testing hormone levels at the wrong cycle phase produces misleading results. Understanding test results requires expert interpretation because normal ranges vary widely and what's normal for general population might indicate androgen excess relative to individual baseline. A testosterone of 50 ing/dL is normal for most women but might represent significant elevation for a particular individual. Free testosterone is often more clinically relevant than total testosterone because it represents the active hormone, though measuring free testosterone is technically challenging and prone to error. Elevated DHEAS, particularly if greater than 350 μg/dL, suggests adrenal androgen excess and warrants further adrenal evaluation. Elevated androstenedione suggests adrenal or ovarian androgen production. Elevated LH with normal or low FSH suggests ovulatory dysfunction characteristic of PCOS. If hormonal testing reveals significant androgen excess, additional testing might assess the source. Adrenal tumors or ovarian tumors very rarely cause acne but can cause very severe hyperandrogenism. Evaluating clinical presentation helps distinguish adrenal from ovarian sources. ACTH stimulation testing can differentiate adrenal from ovarian androgen excess if warranted. Interpreting results in clinical context is essential. You might have borderline elevated testosterone with classic hormonal acne, jawline breakouts, cyclical pattern, making hormonal treatment appropriate despite normal lab values. Conversely, you might have elevated testosterone labs without significant acne, making hormonal treatment unnecessary. Clinical presentation guides treatment more than isolated lab values. When to pursue hormonal evaluation: irregular or absent menstrual periods, acne with cyclical menstrual pattern, acne onset in adulthood, acne concentrated on jawline and lower face, acne resistant to standard treatments, signs of hyperandrogenism, hirsutism, hair loss, male pattern baldness, family history of PCOS or hormonal disorders, concerns about fertility. Other reasons to evaluate hormonal status. Additionally, pursuing evaluation before starting hormonal treatments gives baseline data to assess treatment effectiveness. Working with appropriate clinicians, gynecologists are ideal for hormonal evaluation in women, though some dermatologists also perform this evaluation. Reproductive endocrinologists specialize in hormonal disorders and are appropriate referrals for complex cases or PCOS evaluation. Family medicine physicians can perform initial evaluation. Choosing a clinician experienced in hormonal acne and PCOS improves evaluation quality. After hormonal evaluation, appropriate treatment depends on findings. If PCOS is confirmed, treatment includes hormonal contraceptives for acne and period regulation, spironolactone, antiandrogen, metformin for insulin resistance, and lifestyle modification. If adrenal androgen excess is identified, dexamethasone might be considered. If results are normal despite hormonal acne pattern, empirical hormonal treatment, oral contraceptive or spironolactone, remains appropriate despite normal labs. Timeline for hormonal treatment effectiveness is months, not weeks. Hormonal treatments typically require 3 to 6 months to show acne improvement, with maximal improvement often occurring after 6 to 12 months. Patience is necessary. Discontinuing hormonal treatment after 2 to 3 months before full benefits appear is a common mistake. Reassessment after hormonal treatment initiation is valuable. Repeating key hormonal tests, particularly free and total testosterone, after several months on hormonal treatment confirms that the treatment is achieving hormonal effects. If testosterone hasn't decreased despite hormonal treatment, investigating why: medication noncompliance, inadequate dosing, ineffective treatment choice, is appropriate. Guide 38, Dietary Supplements for Acne, Evidence-Based Review of Oral Supplements. Numerous dietary supplements are marketed for acne with varying levels of evidence. Understanding which supplements have evidence, realistic expectations for supplementation, and appropriate dosing guides inform decisions about supplementation. Zinc supplementation has evidence for acne improvement, particularly in individuals with zinc deficiency. Zinc supports immune function, wound healing, and inflammation reduction, all relevant to acne. Studies show that oral zinc at 30 to 50 mg daily improves acne moderately. However, excessive zinc supplementation, above 150 mg daily long-term, causes nausea and interferes with copper absorption. Typical zinc supplementation is 25 to 30 mg daily. Zinc is more effective for those with demonstrated zinc deficiency, though some people without deficiency also benefit. Blood zinc levels can be tested to assess zinc status, though zinc testing is not widely available. Vitamin D supplementation shows promise for acne. Vitamin D has immune and anti-inflammatory effects relevant to acne. Low vitamin D levels correlate with worse acne. Vitamin D supplementation at 1000 to 1400 IU daily might improve acne, particularly in those with low baseline levels. However, evidence is mixed, and benefits are modest. Vitamin D supplementation is generally safe and supports overall health beyond acne, making it reasonable to consider. B vitamins, particularly B5, pantothenic acid, are promoted for acne. Pantothenic acid is marketed at very high doses, 10 grams daily, claimed to reduce sebum production. While some small studies suggest benefit, evidence is weak. High-dose pantothenic acid causes diarrhea frequently and benefits aren't reliably demonstrated. Supplementation is not recommended without stronger evidence. Omega-3 fatty acids, fish oil supplementation, support anti-inflammatory effects and improve acne in some individuals. Omega-3s reduce systemic inflammation and support skin health. Typical supplementation is 1 to 2 grams daily of combined EPA and DHA. Fish oils.
𝒆𝒓𝒕, at-home skincare devices. What works and what's worth it. Soft calming tone throughout. Approximately 1,700 words. Hello and welcome to this peaceful space. Take a deep breath in, hold it gently, and release. Today we're going to explore the world of at-home skincare devices, understanding which ones actually work, which are worth your investment, and how to use them safely and effectively. The market for at-home beauty devices has exploded in recent years. You can now buy professional-grade technology for home use, LED masks, microcurrent devices, ultrasonic cleaners, derma rollers, and more. It's exciting, but also overwhelming. Let's navigate this together with calm, informed awareness. First, let's establish realistic expectations for at-home devices. At-home devices use similar technology to professional treatments, but at lower energy levels. This makes them safer for self-use, but also means they deliver more subtle results. Think of it as the difference between a professional massage and self-massage, both beneficial but different in intensity and effectiveness. Professional treatments deliver higher energy in a controlled clinical setting with trained practitioners who can monitor your response and adjust accordingly. At-home devices trade some of that power for convenience, affordability, and privacy. This doesn't mean at-home devices don't work. Many do, genuinely. But they require consistent use over time to see results, and those results will be more gradual and subtle than professional treatments. Let's explore specific types of devices and what the science says. LED light therapy devices. LED masks and panels have become incredibly popular, and with good reason. The science supporting LED therapy is solid. Different wavelengths of light penetrate skin at different depths and trigger different cellular responses. Red light, around 630 to 700 nanometers, penetrates deeply and stimulates collagen production, improves circulation, and reduces inflammation. It's excellent for anti-aging, wound healing, and general skin health. Blue light, around 400 to 470 nanometers, stays more superficial and has antibacterial properties, making it helpful for acne treatment. It can kill acne-causing bacteria on the skin's surface. Near-infrared light, around 700 to 1200 nanometers, penetrates even deeper than red light and is particularly good for inflammation, wound healing, and cellular regeneration. Quality matters significantly with LED devices. Professional LED panels can cost thousands of dollars and deliver specific wavelengths at specific intensities proven in research. Many at-home devices claim to offer LED therapy, but use lights that aren't powerful enough or at the right wavelengths to be effective. If you're investing in LED therapy, look for devices that specify exact wavelengths used, not just red or blue. Light intensity measured in MSAM2, FDA clearance for specific claims, clinical studies on that specific device. Good LED devices typically cost $150–$500 for handheld versions, $225–$500 or more for masks or panels. Very cheap LED devices are unlikely to be powerful enough to be effective. For LED to work, you need consistency, typically 10–20 minutes per session, 3 to 5 times per week, for several months before seeing significant results. This is safe, gentle, and backed by science, but requires patience and commitment. Microcurrent devices. Microcurrent technology uses very low-level electrical current to stimulate facial muscles and tissues. Professional aestheticians use microcurrent for facial toning and lifting, and several at-home devices now offer this technology. The theory is sound. Microcurrent can stimulate ATP production in cells, potentially improving cellular energy and function. It can cause muscle contraction, which might help tone facial muscles over time. Some research supports these effects, though more is needed. Popular at-home microcurrent devices include NuFace, 𝒌𝒊𝒏, and 𝒆𝒐𝒏. These typically cost $200–$500 and require daily or near-daily use with conductive gel for best results. Realistic expectations. You might see temporary tightening and lifting immediately after use from muscle stimulation and gel hydration. But long-term results require months of consistent use and are typically subtle. Think slightly more toned and lifted, not dramatically different. Ultrasonic skin spatulas and cleansers. Ultrasonic devices vibrate at very high frequencies to help exfoliate, cleanse, and enhance product absorption. The spatula-style devices claim to extract impurities through vibration, while some cleansing devices combine ultrasonic vibration with traditional cleansing. The evidence for ultrasonic cleansing is mixed. Vibration can help loosen debris and may improve product penetration slightly, but it's not dramatically different from good manual cleansing. These devices are relatively affordable, $30–$150, and safe, so if you enjoy using them and feel they enhance your routine, there's little downside. Just don't expect miraculous results. Ultrasonic cleansing might be slightly more thorough than manual cleansing, but it's not transformative. At-home derma, rolling and microneedling. Derma rollers and microneedling pens for home use have become very popular. These devices create tiny punctures in the skin to stimulate collagen production and enhance product absorption. Here's where we need to be very careful. Professional microneedling uses sterile, controlled needle depths and proper technique in a clinical setting. At-home devices can be risky if not used correctly. Needle depth matters enormously, 0.25 milliliters. Safe for home use, mainly enhances product absorption, minimal collagen stimulation, 0.5 milliliters. Can be used at home with caution, some collagen stimulation, higher risk if used incorrectly. 1.0 milliliters and deeper, should only be done professionally. If you choose to use at-home derma rolling, stay with 0.25–0.5 milliliter needles. Maintain impeccable hygiene. Don't share devices. Replace needles regularly and never use on active acne, broken skin, or infections. The safer alternative is a device like DermaPen or automated microneedling pens designed for home use with built-in safety features. These cost more, $150–$300 plus, but offer better control and safety. Gua sha tools and facial rollers. These are not electronic devices, but they're popular enough to address. Jade rollers, rose quartz rollers, and gua sha stones are ancient beauty tools experiencing modern revival. These tools don't deliver dramatic skin improvements, but they can provide benefits. Lymphatic drainage to reduce puffiness, gentle massage to improve circulation, enhanced absorption of skincare products, stress relief, and self-care ritual. They're inexpensive, $10–50 for quality stone tools, and safe. Use them with facial oil or serum, store them in the refrigerator for extra cooling effects, and clean them after each use. Don't expect these tools to sculpt your face or provide dramatic anti-aging effects. They're lovely for gentle self-care and minor temporary benefits, but they're not miracle workers. At-home chemical peel devices and products. Some brands now offer at-home chemical peel systems that are safer and more controlled than traditional at-home acid application. These typically use lower concentrations of acids with built-in neutralizers or time-release mechanisms. When used carefully according to instructions, these can be effective for gentle exfoliation and skin renewal. However, they still carry risk of over-exfoliation, irritation, or chemical burns if misused. If you try at-home peels, start with the lowest strength. Follow instructions precisely, never leave them on longer than directed, and discontinue if you experience excessive redness, burning, or irritation. Welcome, and take a moment to breathe deeply. Let yourself relax into this peaceful space where we'll explore chemical exfoliation, specifically AHAs and BHAs. The word chemical can sound scary, and acid might make you nervous. But chemical exfoliation, when done correctly, is one of the gentlest and most effective ways to reveal brighter, smoother, healthier skin. There's nothing to fear here, only understanding to gain. Let's begin by understanding what exfoliation is and why your skin needs it. Your skin naturally sheds dead skin cells in a process called desquamation. Every minute of every day, you're losing thousands of dead cells from your skin's surface. This is normal, healthy, and necessary. These dead cells are replaced by fresh, new cells that travel up from deeper layers. When you're young, this process happens efficiently. Dead cells shed easily, and your skin looks fresh and radiant. But as you age, or when various factors interfere, this natural shedding process slows down. Dead cells accumulate on your skin's surface, creating a dull, rough texture. Pores can become clogged. Your skin may look tired and lackluster. Exfoliation helps remove these accumulated dead cells, revealing the fresher, brighter skin underneath, and encouraging your skin to maintain that healthy cell turnover. There are two main types of exfoliation: physical and chemical. Physical exfoliation uses scrubbing particles or tools to manually remove dead cells. Chemical exfoliation uses acids or enzymes to dissolve the bonds between dead cells, allowing them to shed naturally. Today we're focusing on chemical exfoliation, specifically the two main categories, AHAs and BHAs. Let's start with AHAs, alpha hydroxy acids. AHAs are water-soluble acids derived from various natural sources. The most common AHAs in skincare are glycolic acid from sugarcane, lactic acid from milk, and mandelic acid from almonds. Each has slightly different properties, but all work on the surface of your skin. AHAs work by weakening the bonds that hold dead skin cells together on your skin's surface. Think of it like dissolving the glue that's keeping those cells stuck. Once the bonds weaken, the dead cells can shed away naturally, revealing the fresh skin underneath. This surface exfoliation brings multiple benefits. First, it improves skin texture. As dead cells are removed, your skin becomes smoother, softer, and more even. Rough patches diminish. Your skin feels refined. Second, A's brighten your complexion. That dull, lifeless look often comes from accumulated dead cells blocking light reflection. Remove those cells and your skin immediately looks more radiant, more luminous, more alive. Third, Oz can help fade dark spots and hyperpigmentation. By encouraging cell turnover, they help fade areas of excess pigmentation more quickly, leading to a more even tone over time. Fourth, AHAs can reduce the appearance of fine lines. While they won't eliminate deep wrinkles, regular use can soften fine lines by promoting cell renewal and improving skin texture. Fifth, AHAs enhance product absorption. When you remove that layer of dead cells, other products can penetrate more effectively. Your serums, moisturizers, and treatments work better on freshly exfoliated skin. Different AHAs have different strengths and characteristics. Glycolic acid has the smallest molecular size, allowing it to penetrate most deeply. This makes it very effective, but also potentially more irritating. Lactic acid is gentler while still being effective, and it also has humectant properties that help hydrate. Mandelic acid has the largest molecular size, making it the gentlest option, perfect for sensitive skin or beginners. Now let's talk about BHAs, beta-hydroxy acids. The main BHA used in skincare is salicylic acid. Unlike AHAs, which are water-soluble, salicylic acid is oil-soluble. This single difference makes it work very differently from AHAs and gives it unique benefits. Because salicylic acid is oil-soluble, it can penetrate into your pores, which are filled with sebum, oil. This makes it exceptionally effective for treating and preventing clogged pores, blackheads, and acne. It's like having a tiny cleaning crew that can work inside your pores, not just on the surface. Salicylic acid works by dissolving the debris that clogs pores, dead skin cells, excess sebum, and other buildup. It gently clears out pores from within, preventing and treating blackheads, whiteheads, and acne. Beyond its pore-clearing abilities, salicylic acid also has anti-inflammatory properties. This makes it doubly effective for acne-prone skin. It both treats the clogging that causes breakouts and reduces the inflammation that comes with them. Salicylic acid also exfoliates the surface of your skin, similar to AHAs, improving texture and brightness. However, its real superpower is that deep pore penetration. So how do you choose between AHAs and BHAs? If your main concerns are dullness, rough texture, fine lines, or hyperpigmentation, AHAs are your best choice. They work on the surface to brighten, smooth, and even your skin tone. If your main concerns are clogged pores, blackheads, whiteheads, or acne, BHAs are ideal. Their oil-soluble nature allows them to work inside pores where the problems originate. If you have combination concerns, perhaps some dullness plus some clogged pores, you might benefit from using both, though not necessarily at the same time. Now, let's talk about how to use AHAs and BHAs safely and effectively. Start slowly. If you're new to chemical exfoliation, your skin needs time to adjust. Begin with a low concentration, 5% glycolic acid or 0.5–1% salicylic acid, and use it just once or twice a week. Pay attention to how your skin responds. Some tingling is normal when you first apply acids, especially AHAs, but there should be no burning, no severe stinging, no lasting redness. If you experience these, the product is too strong or you're using it too frequently. Gradually increase frequency as your skin builds tolerance. You might eventually use acids 3 to 4 times per week, or even daily depending on your skin's resilience and needs. But this takes time, weeks or months of gradual introduction. Choose the right format for your needs. Chemical exfoliants come in various forms: toners, serums, peels, and pads. Daily toners have lower concentrations for regular use. Peels have higher concentrations for occasional intensive treatment. Start with lower concentration daily products before attempting peels. Apply acids to clean, dry skin. Water can dilute them and reduce their effectiveness. After cleansing, wait a few minutes for your skin to dry completely, then apply your acid product. Wait before applying other products. Acids work best at a specific pH level. Give them 10 to 15 minutes to work before applying other products. This wait time isn't mandatory, but it optimizes results. Always follow with moisturizer. Acids can be drying, so proper moisturization after use is essential. This replaces any moisture lost and supports your skin barrier. Use sunscreen diligently. AHAs increase sun sensitivity by removing that protective layer of dead cells. You should always use sunscreen, but it's especially crucial when using AHAs. Apply SPF 30 or higher every morning. BHAs also increase sun sensitivity, though to a lesser degree. Don't over-exfoliate. More is not better with acids. Over-exfoliation leads to irritation, redness, increased sensitivity, and a damaged barrier. If your skin feels raw, looks shiny, burns when you apply products, or becomes excessively sensitive, you're over-exfoliating. Pull back immediately. Signs of proper exfoliation include smoother texture, brighter appearance, easier product absorption, and comfortable skin. Signs of overexfoliation include redness, burning, excessive sensitivity, shiny or tight skin, and increased breakouts. Be cautious about combining acids with other active ingredients. Acids plus retinol, acids plus vitamin C, acids plus more acids. These combinations can be extremely potent. If you use multiple actives, consider alternating them on different days, rather than layering them all at once. Who should avoid acids? If you have very sensitive skin, active eczema, rosacea flare-ups, or severely compromised skin barrier, acids may be too irritating. If you're on certain medications like Accutane, check with your dermatologist before using acids. Pregnancy and breastfeeding. Most AHAs are considered safe in moderate concentrations. Salicylic acid in leave-on products should be used cautiously and only in low concentrations, 2% or less. Always consult your healthcare provider. Let's discuss results and patience. Chemical exfoliation doesn't produce overnight miracles. You'll likely notice immediate smoothness after your first use, but significant improvements in texture, brightness, and clarity take time. Give it 4-6 weeks of consistent use before evaluating whether it's working for you. Some people experience initial purging when starting acids, especially BHAs. Purging means existing clogs surface more quickly, causing temporary breakouts. This is normal and usually resolves within a few weeks. If breakouts persist beyond 6 to 8 weeks, it's probably not purging but an actual negative reaction. Storage matters with acids. Keep them in cool, dark places. Some acids, particularly vitamin C combined with acids, can oxidize when exposed to light and air. As we close, remember that chemical exfoliation is a powerful tool for healthier, more radiant skin. Used wisely with patience and respect for your skin's needs, AHAs and BHAs can transform your complexion. But they require responsibility. These aren't products to use carelessly or aggressively. They're potent ingredients that demand understanding, patience, and proper sun protection. Take a deep breath in and release it slowly. Consider whether chemical exfoliation might benefit your skin, and if so, commit to using it thoughtfully and safely. May your skin be bright, smooth, and healthy. May you approach powerful ingredients with wisdom and care. May you find balance in your skincare routine. Thank you for this time together. Be well and be gentle with yourself. Welcome to this calm, peaceful space. Take a moment to breathe deeply. Today, we're going to talk about retinol, perhaps the most powerful anti-aging ingredient in skincare. Retinol has a reputation. Some people swear by it. Others are intimidated. The truth lies in between. Retinol is incredibly effective when used correctly, but it requires respect and patience. Let's begin by understanding what retinol is. Retinol is a form of vitamin A. It's part of a family called retinoids. When you apply retinol to your skin, it converts into retinoic acid, the active form your skin cells can use. What makes retinol special is its ability to communicate with skin cells, telling them to behave like younger, healthier cells. Retinol increases cell turnover. Your skin sheds old cells and generates new ones, but this slows with age. Retinol speeds it up, revealing fresher, brighter skin. Second, retinol stimulates collagen production. Welcome and breathe deeply. Today we discussed preventing acne by keeping habits clean. Simple hygiene practices that significantly reduce breakouts through consistency and awareness. Clean habits are fundamental to acne prevention. While acne has multiple causes, hormones, genetics, stress, poor hygiene can worsen it, and excellent hygiene can help prevent it. These habits are simple, cost nothing, and make a real difference. Let's explore each clean habit that supports clear skin. First, face touching. Your hands touch countless surfaces throughout the day. Doorknobs, keyboards, phones, money, accumulating oil, bacteria, and dirt. Every time you touch your face, you transfer these to your skin where they can clog pores and cause breakouts. Become conscious of how often you touch your face. Most people do it unconsciously dozens of times per day, resting your chin on your hand, rubbing your eyes, picking at blemishes. Set an intention to keep your hands away from your face unless you're cleansing or applying products with clean hands. If you must touch your face, wash your hands first with soap and water. This simple act prevents transferring bacteria and oil. Pillowcases require special attention. You press your face against your pillowcase for 6 to 8 hours nightly. Throughout the week, it accumulates oil from your skin and hair, dead skin cells, product residue, dust, and bacteria. Sleeping on a dirty pillowcase reintroduces all of this to your skin night after night. Change your pillowcase at least twice weekly. If you're very acne prone, change it every night or flip it to the clean side and change daily. This simple habit can dramatically reduce breakouts. Choose soft, breathable fabrics. Silk or satin pillowcases are ideal. They're gentle on skin, don't absorb as much oil as cotton, and cause less friction. If silk is too expensive, soft cotton works fine as long as you change it frequently. Keep several pillowcases on hand so you always have clean ones available. Make changing your pillowcase part of your routine. Towels also matter. Your face towel accumulates bacteria with each use. Using a damp, bacteria-laden towel on freshly cleansed skin reintroduces problems. Use a clean towel for your face every time you wash it. Dedicate one small towel for your face only and wash it daily, or use disposable paper towels for drying your face, or air dry your face naturally. If you share towels with family, have your own designated face towel and wash it frequently. Your phone deserves attention. Think about how often your phone touches your face during calls and how many surfaces it contacts throughout the day. It's a breeding ground for bacteria. Then you press it against your cheek, transferring all that bacteria to your skin. Clean your phone daily with a disinfecting wipe safe for electronics. Focus on the screen and edges that touch your face. Use speakerphone or earbuds when possible to avoid direct face contact. If you must hold your phone to your face, clean it first. Hair hygiene affects your skin, especially along your hairline and forehead. Hair products, oils, pomades, gels, dry shampoo can migrate onto your skin, clogging pores and causing breakouts. Dirty hair carries oil and bacteria that transfer to your face. Wash your hair regularly based on your hair type and oil production. If you have oily hair, daily washing might be appropriate. Change your pillowcase after washing your hair, as wet hair can leave additional residue. Keep hair products away from your face. Apply them carefully, avoiding hairline and forehead. Pull hair back from your face, especially while sleeping. If you have bangs, wash them frequently or pin them back while your skin heals. If you use dry shampoo, be especially careful. The powder can settle on your face and clog pores. Apply it away from your face and brush your hair thoroughly afterward. Makeup brushes and sponges harbor bacteria if not cleaned regularly. Each time you use a dirty tool, you're applying bacteria along with your makeup. Clean makeup brushes weekly with gentle soap or brush cleaner. Wash sponges after each use or use disposable sponges. Replace brushes and sponges regularly. Every 3 to 6 months for brushes. More frequently for sponges. Between washings, spot clean brushes with brush cleaning spray if used daily. Store brushes and sponges in a clean, dry place where they can air out. Sheets and bedding extend beyond just pillowcases. Your face may contact your sheets, especially if you move during sleep. Wash all bedding weekly in hot water to kill bacteria and remove accumulated oils and dead skin cells. Consider using fragrance-free, gentle detergent if you have sensitive skin. Harsh detergents or fabric softeners can irritate skin and cause breakouts. Hats, scarves, and anything worn on your head or face should be cleaned regularly, especially if worn during exercise or in warm weather when sweat accumulates. These items contact your skin and can trap oil, sweat, and bacteria against it. Exercise equipment that touches your face, helmets, headbands, protective gear, should be cleaned after each use. Wipe down with disinfectant or wash if possible. At the gym, wipe down equipment before use if your face might touch it. Bring your own clean towel rather than using gym towels of unknown cleanliness. Glasses and sunglasses rest on your nose and near your skin. The nose pads and frames accumulate oil and bacteria. Clean them daily with gentle soap and water or lens cleaner. Pay attention to nose pads in areas that touch your skin. Hands must be clean when applying skincare products. Always wash your hands thoroughly before your skincare routine. This prevents introducing bacteria and dirt to your products and face. Avoid dipping fingers repeatedly into product jars, which can contaminate products with bacteria. Use clean spatulas or pumps when possible. If you must use fingers, wash them first each time. Keep your bathroom and skincare area clean. Wipe down counters regularly. Store products in a clean, dry area. Don't leave product caps off where they can collect dust and bacteria. Dental hygiene affects your mouth and chin area. Bacteria from your mouth can cause breakouts around your lips and chin. Brush teeth twice daily and floss regularly. Change your toothbrush every 3 to 4 months. These clean habits work together synergistically. Each one individually helps. Combined, they create a foundation for clearer skin. Make these habits automatic through consistency. Set reminders if needed until these practices become second nature. Within weeks, they'll be ingrained habits requiring no conscious thought. These habits are especially important during active breakouts, but maintain them always for prevention. Clean habits prevent new acne while you treat existing breakouts. Remember that hygiene is just one piece of acne prevention. Proper skincare, stress management, adequate sleep, balanced diet, and sometimes medical treatment are also important. But clean habits are within your control and cost nothing. As we close, embrace clean habits as acts of self-care that support clear skin. Simple hygiene practices, maintained consistently, prevent acne by reducing bacterial transfer and pore clogging debris. May you develop clean habits effortlessly.